Welcome again, everyone. Swamy Ji is here with us. Pranam Swamy Ji. Welcome to the session. The first question that we need to take up today is from a allopathic professional. She says, I am myself a doctor. I have tried naturally for 2 years, tried multiple follicular studies and 5 IUI, all failed. I have one kid of 5 years, which I conceived naturally. I am unable to conceive for the second time. Husband reports show Teratozoospermia and I have PCOD. Rest of my reports are normal. Can I be helped with Kumbhak therapy? Over to you, Swamy Ji.
So the way we are approaching fertility, it's just on the same line of testing the biochemical parameters of the body. AMH count, sperm count, azoospermia, teratozoospermia, and you can name anything. But it is basically biochemical matrix through which we are trying to understand fertility. There are many things which we are not focusing at, which can be of more help to the humanity at this point of time. Like, I'll say, body or the whole universe works on two factors, pressure and temperature. This is the basic fundamentals of physics. With pressure and temperature, this body works. Now, even the biochemical matrix or the biochemical parameters, they depend on the kind of pressure ecosystem and the thermal ecosystem of the body. The last part is material management. ज्यादा ज्ञान हो रहा है क्या? तो ये शरीर जो है ना, प्रेशर और टेम्परेचर पे काम करता है. मटेरियल मैनेजमेंट, आपके शरीर में कितना भोजन इस्तेमाल होता है, ये डिपेंड करता है प्रेशर इकोसिस्टम ऑफ द बॉडी और टेम्परेचर थर्मल इकोसिस्टम ऑफ द बॉडी. इस तरफ में कोई ध्यान ही नहीं दे. 100 साल पहले जो पद्धति निकली एक तरीके से शरीर को देखने की, उस पद्धति ने फर्टिलिटी तो बढ़ाया नहीं अभी तक. अगर आप डॉक्टर हैं तो आपको तो मालूम ही है ना, फर्टिलिटी दुनिया के नीचे जा रही है. डायबिटीज बढ़ रही है, ब्लड प्रेशर बढ़ रहा है, थायराइड का इशू बढ़ रहा है, पीसीओडी केसेस बढ़ रहे हैं, कैंसर केसेस बढ़ रहे हैं. ये सब एपिडेमिक होने वाला है. So we have not helped the body. We have only tried to manage some symptoms. Symptom management is essential when the situation is very, very critical. In a critical situation only, you should suppress the symptoms and try to survive or try to make the person live. On survival aspect you can work. But then, empowering the human body, we have not worked enough. फर्टिलिटी में प्रेशर का पार्ट सबसे ज्यादा होता है, सबसे ज्यादा प्रेशर का पार्ट. दैट इज व्हाई इवन देयर इज अनडायग्नोस्ड इनफर्टिलिटी, बिकॉज द डायग्नोस्टिक्स इटसेल्फ हैज अ वेरी मच लिमिटेशन. वी कांट इवन डायग्नोज 1% ऑफ द टोटल बॉडी फंक्शन with the current diagnostic system or the current diagnostic ecosystem. Undiagnosed infertility होती है और हमें मालूम नहीं क्यों इनफर्टिलिटी हो. आयुर्वेद इसे कहता है वात पित्त कफ. प्रेशर इज वात, टेम्परेचर इज पित्त, मटेरियल मैनेजमेंट इज कफ. So these things has to be balanced and it can be balanced only through pressure. प्रेशर से ही बाकी दोनों चीजें भी बैलेंस होती हैं. That is why we are bringing up this aspect of health and fertility, where by breath hold formulas, we try to correct the pressure ecosystem, thermal ecosystem, and the material management of the body. That is why this is the program where AMH count increases. In 1 month's time, you'll see AMH count goes up. Or even you can come out of a zoospermia or any kind of a sperm discrepancy. Right, we have seen ladies who have low quality of eggs and the follicles would not burst. After doing Kumbhak, the follicles would burst and there would be good quality of eggs. These are, we have reports of that. The chromosomal defect can be corrected through Kumbhak. We have reports of that. We have done the world's first scientific experiment correlating Kumbhak with mitochondria health. Without mitochondria health, your body cannot do anything. Let me tell you that. Kumbhak increases mitochondria health drastically. Within 4 weeks, we have seen it increasing. So we need to look towards the health or fertility from a completely different perspective. Only then we can create more and more solutions for the world. That is why we have a very unique diagnosis called Prana Shakti diagnosis, which is one of its kind in the world. But we want to come up with many more diagnosis or diagnostic ecosystem like that. We are trying to do research on pressure chambers where we can help people who are into a critical situation. So we need to look at health from a completely new perspective, because from the last 100 years, the current ecosystem of health or disease, the current dispensation of treating disease, allopathy, has not helped anybody in chronic disease. I'm not talking about infection. NID, non-infectious disease. 80% of total problems are non-infectious in nature. So we need to come up with some more robust ways of looking at health, looking at disease, and help people come out of it.